Poder Ciudadano has been campaigning against corruption in Argentina for many decades. I'm Ana Pichon. I have been working with the support of PTF as Poder Ciudadano has engaged in critical healthcare issues, starting with the challenges that COVID-19 produced. Our advocacy model for strengthening integrity ecosystem aims to protect public goods and services from a human rights perspective, understanding the actions, mechanisms, and procedures of prevention, early detections, and avoidance of irregularities. Our efforts are based on four strategic pillars. First, ethical exercise of the public function. Second, transparency and maximum disclosure of the acts of government. Three, participation and social control of public management. And four, accountability. The intervention model aims to strengthen the entire value chain: prevention, detection, investigation, sanction, recovery of property, and reparation of victims. I would like to tell you our four-tier strategy we use as a civil society organization to fight against opacity and demand greater accountability. During the COVID-19 crisis, this was our roadmap on public policies from the integrity and human rights perspective. Number one, monitoring institution. First of all, gathering information. This was our first decision since there was little or no information available on the government's response. The vaccine purchasing processes flouted the norm. Under the cloak of confidentiality clauses, nothing was published about the purchase and distributions of COVID vaccines. This first, the first thing to know was what information was available and what wasn't. We mined the websites of multiple government agencies responsible for vaccine procurement, international suppliers such as the PAO, founding agencies, and CSOs in other countries with more open information systems on vaccine purchases. After mining the websites, our strategy included a series of freedom of information requests on different matters. The quality and quantity of the response varied. The objective was to unify and simplify information for citizens in general and facilitate detection of alerts about incomplete, contradictory, or missing information. Second point, monitoring. We also monitored relevant irregularities such as a preferential VIP vaccination. Through FOIA requests, we were able to identify the names of people who entered different public buildings who were not officials who benefited from the COVID-19 by passing the prioritization scheme. The scandal led to the resignation of the health minister and a judicial investigation. We also monitored the entry of the official residence of the presidents. From these lists, we discovered what was called the Olivos Gate, the First Lady's birthday celebration in the midst of a context of total isolation. This also led to a judicial investigation. Number two, generating information and evidence. The first thing we did was to create a website, the Observatory, which was the single most important source of information for the public in Argentina. For years after the pandemic erupted, the observatory has public information the Ministry of Health has not published, such as the cost of vaccines by brand, cross-by distribution information. Second, the prompting response. Thanks to the demand of permanent information on vaccines, the Ministry of Health eventually created a macro site with summary of information on, I quote, most relevant information, unquote, of the contracts and the portal for monitoring the application of the vaccines. Number three, building networks. Poder works systematically with other nonprofits, the media, and the academic community to build coalitions to demand more transparency and accountability in the COVID response. Collective action is critical. It is essential to generate alliances with different types of stakeholders to carry forward the action program. Alliances were generated with CSOs, both in Argentina and in the region, to carry out knowledge and dissemination activities. To raise awareness and for more technical evidence to reach people in understandable ways, we found interlocutors to disseminate the message to the greatest number of people. The media was also critical. Number four, engage constructively. Poder, Poder worked with different public institutions to promote transparency and demonstrate the value of civil society engagement. With the Ministry of Health team, we work within the framework of the Open Government Partnership Action Plan on access to information and health services providers. But the most relevant and effective work was done with the public authorities of the Supreme Audit Institution and the Administrative Investigations Attorney's Office. The General Audit Office detected series of irregularities in the contracting made by the Ministry of Health, but the report was declared confidential and has never been made public. Similarly, the prosecutor's office, to whom we presented reports on non-compliance in vaccine procurement, carried out a complete investigation and monitoring not only for compliance with legal obligations, but investigated suspicious cases. The consequences of these investigations are still unclear. Number 5, strategic litigation. When absolutely necessary, Poder Ciudadano challenged in court the resistance of the authorities to making information public. When all other avenues were exhausted, there was no other choice but to resort to justice. This is what is happening regarding access to information on the contracts for COVID-19 vaccines. We are still in litigation in the Supreme Court of Justice to determine the interpretation of the Ministry of Health made of the COVID vaccine law, the complete confidentiality of the contract, while we interpret the public nature of the contract and the inclusion of some confidentiality clauses. We brought a second case against the Supreme Audit Institution, challenging the confidentiality of the audit reports. We're still awaiting resolutions at the Court of Appeals. Collaboration and dialogue with governments depends on the issue and the circumstances. Governments can dialogue a lot, a little, or not at all. The state of exceptionality generated by the pandemic reinforced governments' opacity and disregard for transparency. Given the uncertainty of the early 2020, Poder adopted a risk monitoring strategy and carried out surveys on what was being published by the government. This allowed us to generate information and diagnosis to be able to inform the public on decisions and the use of public resources in order to prevent and detect possible acts of corruption. In a world where democracies are increasingly fragile and the capacity of governments to defend themselves from global attacks and abuses are fewer, the key remedy is with citizenship, the central bond for mutual trust based on transparency. Thank you.